You need to know that patients' medical history and diagnosis must never be a menu on the gossip table of medical health practitioners. Yes, what we are saying is every patient has the right of confidentiality. Your medical history, your medical diagnosis is confidential to you. Now, let's look at this scenario. A doctor, a nurse, or lab technician goes about saying, do you know Mr. A? This is his diagnosis. Mr. B is suffering from so and so disease. That is absolutely wrong. It is a medical misconduct and it is also illegal. Section 26 of the National Health Act 2014 makes it clear that the diagnosis of a patient is very, very confidential. No medical personnel, doctor, nurses, or whoever has the right to disclose your medical condition. They cannot discuss it in public. They cannot discuss it in private. If any health practitioner, health facility, or lab attendant discloses your result, he is liable. It is a professional misconduct, and you can also take out action against this person. Be that as it may, the only provision that the law makes available for the medical health practitioners to disclose your health status is one, where you have given your consent. Number two, when it is a public interest issue or where there is a court order or any related lawful issue. Has anybody has the experience of hearing your medical condition being discussed outside because it's being revealed by a medical practitioner? If you have issues like this, you can drop it in the comment. Let's discuss it. And today we are telling you that it is wrong. No medical facility, no medical practitioner of under any condition outside what is provided by the law can disclose your medical condition. If they do that, they are breaching your right to confidentiality. And you can sue the hospital, you can sue the person involved in this so that your right will be redressed. Let's go to the next right that you need to know. Every patient upon coming to the hospital before treatment is being administered, you have the right to know what is wrong with your body. It is very common that people just go to the hospital, doctors, nurses attend to you, write medication and say, take this. I give you a practical scenario. When I was still in the university, I was taken to the hospital because my sister is a nurse. According to her, they feel they've taken me to the best consultant in the clinic at the time. So I sat in front of him. The usual Nigerian student, they had to beg him, this one is a sibling of sister, this. So let me just make time to attend to him. I sat in front of him. While I was trying to tell him what was happening to me, the man pushed a paper to me that this is your prescription. I was surprised and I told him I'm not going to take it. My sister himself and the people there were highly disappointed. Why? The person did not even listen to me. I didn't feel he understood what was happening to me, but in his capacity, he thought I'm a professional. I've handled these cases long ago. Just take this. What we want you to know that as you go to the hospital, it is your right to know what is your diagnosis. It is your right to know the alternative treatment, the risk involved in your treatment, the options available, the estimated cost of your treatment, because you need to understand this fully before any medication will be administered to you, except where your case is an emergency. And even in an emergency case where the patient cannot understand this, the patient relatives have to be carried along. Now, you don't need to bug patients with big medical terms. The law provides that the medical practitioner must understand it as simple as possible to the understanding of the patient. Have you been to the hospital? There are situations you see people in hospital 2-3 days on admission. They cannot tell you what is their condition. They cannot tell you what they are being treated for because nobody took his time to explain it to them. That is wrong. You have the right to ask the hospital, what is my diagnosis? What am I being treated for? What is the risk involved in my treatment? What is the risk in my condition? This treatment you are giving me, is there an alternative or this is the only option? It is your right. Let's make our hospitals better. Let's respect our patients. Please drop us a comment on your situation. Let us discuss. Let us collectively make our hospitals better. Let us make the health sector better. Remember to subscribe to this channel so that you keep getting our information, our updates all the time because we have your best interests.